Hello, everyone. My name is Barbara Wingward. I'm just going to take a couple minutes to speak about something that I'm passionate. I began my travel nurse career in the midst of the COVID-19 pandemic in 2021. I decided to leave the East Coast and go and try the Midwest and see what that was like. I was welcomed with open arms, and I later found out it was because of their critically low staffing, nurse staffing. I left a one nurse to three patient ratio progressive care unit to a one nurse to seven patient ratio progressive care unit. That was a big change for me, but I had to adjust. A big thing for me was routine. I had to do everything by a schedule. And I started every shift by getting handoff from my nurse, just trying to find out as much information as I could about a patient, and then automatically started vital signs, assessments, and med pass. Vital signs consisted of, blood pressure, heart rate, oxygenation levels, temperature, and then your respiratory rate. I then did a focused assessment on heart, lung. I asked them a couple of questions to see where they were at, if they were alert oriented, if they knew what was going on, why they were in the hospital, that kind of thing. Just kind of see the patient's baseline for me. Once I compared my findings and the findings that the previous nurse told me, and I came to the conclusion that everything was about the same, I proceeded to do my nighttime medicines. On this one night, I remember I was walking from one room to another room to finish my nighttime med pass and vitals. I probably had about two rooms left, but I walked past a room that I had already completed my nighttime medications with, and I noticed that they were kind of slumped in the bed, just looked different. So I went in the room, I asked her a couple questions, and she was answering them fine, but just very short, dry, withdrawn, which was not what I had experienced earlier in the shift. I just said, hey, I'm going to go ahead and just do a set of vitals, take another quick listen, and see what's going on. I noticed that her vital signs were a little off. Blood pressure was lower than we wanted, about 80s over 40s, and her oxygenation level was low. She had previously been in the high 90s, 100 being like gold standard, and she was maybe sat in a little bit above 80, like 82%. Same time, I'm listening to her lungs, and I noticed out on her right side, I don't hear any air passing, the normal that you can hear when listening to lungs. And I, at the same time, put oxygen on the patient and went ahead and called my charge nurse. We activated the medical rapid response team, which is a team that we have on site that just helps with these sort of situations. They get somebody there that is seasoned, knowledgeable, experienced with these kind of situations at the bedside so that we can fix the patient or do all the interventions that we can while they're on this unit. They suggested a chest x-ray. Doctor also came to the bedside. Chest x-ray showed a spontaneous pneumothorax, which is basically when air builds up between the lung and the chest wall, causing the lung to not be able to expand and potentially collapse in. So ultimate decision was to transfer this patient out to the intensive care unit so that the doctors could place a chest tube. Chest tube being basically what it sounds like, a tube that they put in the chest that allows the trapped air to be released and then the lung to reinflate. This night has stayed with me for years now, and even to this day I think about it. What could have happened if I would have had a less patient assignment, if I would have been able to been with her for a longer time on my initial assessment, if I would have been able to check on her more frequently, if I would have caught it early on, if she would have had to have been transitioned up to the ICU. I also think about, what if I didn't walk past the room? What if I would have found her in an hour or two? Where would she have been then, So that is something that is a huge problem right now in nursing. The lack of nurse staffing, the shortage. It's not anything that's new, but I think COVID-19, the pandemic, just exacerbated that shortage, causing a lot of nurses to leave the bedside or even leave nursing altogether. Another thing that is spoke about from the future of nursing 2020 to 2030 is the maldistribution of nurses in the current workforce. So, aside from the current shortage, the nurses that are working, they're mainly found in one or two or three specialties. They're not distributed in these undersized specialties that are just always kind of been understaffed, but now are just growing. That include the specialties that have to deal with the aging population and then just mental and behavioral health. Um, I think there might be a lot of reasons as to why those units are understaffed, but I did do some research and found some data that showed that the average skilled nursing facility, which takes care of majority of the aging population, has a ratio that is determined by time, or time per patient per day. So the national average is 45 minutes. So, for example, if a nurse has a 10-hour shift, they would multiply that by 60, divide it by 45, and you would get 13 patients. That would be your caseload for your 10-hour shift. And aside from that, I found a study that showed that for every patient over a 1 nurse to 4 patient ratio, there is an increase in 30-day mortality of 16%. So you can imagine that is huge risk factors with increase in ratios. And also in like psychiatric care, I believe that the standard is 7 to 8 patients. I think an aspect that we should focus on to help with workforce distribution would be just providing those safer assignments and increase in job satisfaction. I think that nurses hear and they know about what these ratios are like, and that it's retention's hard when ratios are that high. And also, I think nurses are less likely to apply to jobs when they know that the ratios are that increased. I think just implementing patient ratios aren't only going to retain nurses, but it also increases patient safety and overall patient outcomes.